I'm afraid I've kept Dr. Karol Sikora, a very important man, waiting to talk to me. So listen, very good to see you. First time you've been in here.
It is a fantastic
Isn't
studio.
that amazing? Because you and I have been speaking now since before COVID started.
Long before.
During COVID, we met a few times during COVID as well. It's been quite a journey. We've now got the COVID inquiry going on. Not sure what we're learning from that. You're looking very well, by the way.
Thank you very much.
And so this morning you're here to talk about NHS delays causing 100,000 cancer patients to get even less well than they should be.
Yeah, this is a survey released by Macmillan Fund this morning, looking at a survey of patients and their experiences with delays when they're diagnosed with cancer or on the process of being diagnosed. Every month of delay costs lives, a significant number. The stage shifts from being early stage to later stage, more difficult, more expensive to treat, and poorer outcomes. So what the Macmillan Fund have done, tremendous service really, is point this out. The target's pretty easy. 62 days is the target from diagnosis to treatment. That should be met for everybody. It's less than 60%. This is atrocious.
It really is. And how does that compare to other countries around the world? I know other countries are much better at this, aren't they?
They are. In France, if you have cancer-like symptoms, you'll be sorted out within a week. Scans, biopsies, pathway, treatment plan. You know, it was getting better before COVID, but now it's just knocked back. What annoys me most are the high priests of the NHS that sit just across in a tower block not far from here in Elephant and Castle and just say, oh, we put billions into it, it's all being corrected. But the data, such as this survey, show it hasn't been corrected.
But this is the trouble, isn't it? Because we hear all the time that the NHS needs more money, needs more nurses, needs more doctors, but I mean, it does get an awful lot of money, an incredible amount of money. And if they can't work with that money and make it work efficiently, particularly for cancer care, I mean, what can they do?
I think the only thing you can do is extend the working days of hospitals. You know, weekend working is now commoner, but night working until midnight, patients don't mind. They don't mind coming. You provide a car, they come and have a scan at 10 o'clock at night, they go home, there's no traffic, you can park your car easily. Let's get this going, just like the vaccination.
I think if you asked anyone who was in need of an operation or a procedure of some kind or another, I don't think they care when they come in. As long as they're getting it, they'd rather not wait. I mean, I walk past Guy's cancer unit every single morning to come to work and every single afternoon, and I'm always staggered when I come at the weekends to find that there's literally nothing going on. There's no ambulances there, there's no patients sitting outside as they often do in their wheelchairs, there's no taxis picking people up, there's just nothing going on. I mean, and surely those 2 days they could fix the backlog.
Yeah. And even just working Saturdays, that would give you 20% more activity, nearly 20% activity. That's what you need to do to get the backlog. And then we've got to think about the steady state and how to speed it up. You know, sure, there's a lot of restricted practices in healthcare, you know, how many radiographers you need to run a machine, how many doctors you need to run a clinic and so on. And we've learned a lot with Zoom calls and Teams and so on, how we can work more efficiently at a distance. But, you know, changing the system, it's like changing a bureaucracy that's gone completely bonkers.
Right. And, I mean, is there, I know you and I have had this conversation many times, is there a sort of, aside from, say, opening on Saturday, is there a single kind of management change that you could see that you could make that would instantly free a lot of people up?
I think you've got to get rid of the political correctness.
Yeah.
You know, I'm doing my appraisal on Friday night, and, you know, I've had to do about a week's equivalent work to do that, which is non-contributory. Diversity training, all this stuff, get it all signed up, bureaucracy. What's the point for someone of my age? I've been around long enough to know. And it's the same for all my colleagues. Let's get
sort of box-ticking exercises.
Let's make sure we actually get what matters for patients.
And in terms of actual kind of clinical improvements, there is a new blood test that's being offered at the moment, a piece in the Times this week, saying it can identify 50 different cancers. And this is the kind of news that you look forward to, isn't it? That technology is helping medicine to improve the treatment of people.
You know, when I was first a consultant, only about a third of patients were cured with cancer. Now it's over 50%. So what an opportunity. Technology is bursting to come forward, but we have to have an infrastructure to cope with that technology and put it into practice.
Right. And so this particular blood test will again be only good if people can get it, but it says it can be carried out by people in their own homes.
It's a blood test, you send it away, and you get the result back. The problem, of course, is they're just going to join the queue of all the people in the queue for diagnostic scans, diagnostic biopsies, because that's what happens. And so some of them will be worried, well, and that's why they're doing it. They'll be even more worried with a positive test. They'll be even more worried still when they can't get sorted out quickly. Right. If it takes 2 months to sort out, that's pretty stressful for an individual.
And I speak to a lot more people now who are taking up private medicine, not necessarily because they can afford to, but because they're having to kind of make enough money available to themselves to do it, because they're simply so frustrated by not being able to see an NHS doctor when they want to, by not being able to just, pick up a phone and get some advice, because it's all become so wrapped up in red tape.
It has, and the problem we've got, the NHS can provide the finest care in the world, there's no doubt about it. There's nothing wrong with the quality of the technology. The trouble is it's variable, and there's huge postcode lotteries for everything, not just for cancer, but heart disease, stroke, everything. Different people are getting different quality of care.
Well, this is it. The Labour Party often talk about how the Tories have wrecked the NHS, and then people go, what about Wales, where the Welsh are in capable hands of the Labour Party, where it's even worse?
Completely so. I've got experience in Wales. It's just, it's funded well, but organisationally appalling, and people are suffering because of it.
Yeah. And how long do you think you and I are going to have this conversation for? Because it's now been years since nothing has changed and nothing has improved.
What annoys me particularly about this whole situation is neither Labour nor Conservatives have any idea what to do. They just talk, and any radical restructuring is pushed aside. What's needed now is backlog clearance. That's exactly like the vaccination programme. You get volunteers in to make the tea, you get...
And that worked really well, didn't it?
It worked extremely well. Let's do the same for cancer. Let's do the same for heart disease.
Right.
Clear the backlog, get a steady state, and then move forward.
Yes. Sounds simple, doesn't it?
It does.
You'd think it would be. We shall see. Dr. Karol Sikora, lovely to see you. Thank you very much indeed.